Perfect. Thank you so much. So I'd like to welcome Dr. Marian. She has been with Holistic, I don't know, maybe 10 years now, first as a patient and then as a resident physician and now as an associate. So we have absolutely loved having her. Please make sure that you turn down your, or put on your mutes. It's because we're getting a lot of reverberation going on. And so Dr. Marian, one of her specialties is women's health and chronic complex conditions. And so she'll be talking to us about women's health today. And the reason we picked this topic, it's all of this chaos that's going on right now, is because women, whether we want to believe it or not, are the very first educators of children from the moment of conception. And of course, once the baby is born, one of the other parents may take over, but from the moment of conception, and sometimes even preconception, we like to think of, is that the woman's health, the vibrations, the thoughts that we may have, the emotions that we may be going through, the experiences that we may be having during pregnancy, all of those vibrational frequencies get passed on to that baby. And so we have the capacity to educate the baby from the moment that it's conceived by the things that we say and hear and read and understand. And so it makes it very, very important for women to become aware of what they can do to maintain their health, but also the impacts that they have on the well-being of future generation, which is ultimately what we want, is to be able to educate our children from the very moment of conception and help them recognize the oneness of humanity. So without further ado, I'd like to pass this on to Dr. Marian, who will give us a better perspective of how to keep our health. Thank you, Dr. Marian.
Okay, hi everybody. Sorry that you can't see me, but I guess the slides are the more important thing anyways, but let's see. Oh, there we go. Okay, so this is me. My name is Marian. I went to Bastyr University. I'm a naturopathic physician. I specialize in integrative primary care, but my true passion is complex chronic illness, as Dr. Darvish had mentioned. And that includes really a variety of things, but some of the things are autoimmune diseases, environmental toxicity, including heavy metals, women's health, which we're going to be talking about today. I also really like to manage gastrointestinal disorders as well as integrative mental health conditions. I consider myself trauma informed. I've done a variety of training and education, postgraduate education on complex PTSD and issues around trauma. And I really like to focus on physical, energetic, and spiritual health as a combination of three things that really promote overall health. And then I also do autonomic response testing, which some of you are probably very familiar with, and that's a form of energetic testing that we do here at the clinic. That helps us to understand our patients better and some of the treatments that might be best fit for them. So what I'd like to look at initially are the naturopathic principles, and really just go back to the basics of why we are approaching things the way that we do. And the first naturopathic principle is first do no harm. And the Latin translation is primum non nocere. And that's really important because that is the foundation of behind our decision making in, are we going to utilize a treatment or are we going to not utilize a treatment, and so forth. And so that's really informing our decisions, is to not do any harm to our patient. The healing power of nature is the second naturopathic principle. The Latin translation is vis medicatrix. There's an X missing, nature. And that really just means Let's see if everybody could just mute their Zoom. There's a little bit of feedback. I think there's a sync on. The healing power of nature really means essentially that we are nature, we are beings of nature, and it is in our nature to heal. So when you cut a leaf, or when a plant is wounded, it is automatically the process to heal. And so the same happens in human beings. Again, everybody could just mute the camera, mute the Zoom. So the same thing happens with human beings. When you cut yourself, the wound naturally starts to heal. The third naturopathic principle is identify and treat the cause. And that is really one of my favorite principles, because we are always working to find root underlying cause of symptoms rather than suppress symptoms. One of my favorite examples is in children when there's eczema, and conventionally they might use topical steroids. Hi, Dr. D. Dr. D is going to help me out for a second.
If I can, if we go to participants.
Oh, okay. Perfect. Awesome. Okay, thank you. Okay, so I just muted everybody except myself. I think that'll work better. So I think I was on identify and treat the cause, and that's a really important principle because we are always looking to find the root underlying cause. And one of my favorite examples of this is in children when there is eczema. Conventionally, they might use topical steroids. And steroids are essentially suppressing the immune system. It's an immune suppressant. And we often think about when we suppress the pathology then is driven deeper. And so children that are given topical steroids for their eczema may then develop asthma or more significant allergies because the root cause was not identified and the pathology was suppressed and pushed deeper. Whereas if you identify the root cause, often with children in eczema, that's a food sensitivity issue or a gastrointestinal issue. You can then cure the situation, the problem, and not suppress pathology, and the treatment is more curative. The fourth principle is doctor as teacher, and naturopathic doctors do a lot of teaching. We spend a lot of time with patients, ensuring that patients understand the disease process in their body and also the treatments and how the treatments are going to be helpful. The fifth principle is treat the whole person, which is tole totem. And that means that we look at the whole person as a unified system. We don't just look at the liver. We don't just look at the thyroid. We don't just look at the uterus. We look at the whole person as a system. And so we might look at a lot of the relationships between liver and gut and adrenals and gut and thyroid, and really just look at the whole person. And that allows us to develop more holistic treatments. And the sixth principle is prevention, health, and wellness. Prevention being the primary or the most important aspect here, and that is because prevention really is the truest form of medicine, in that if we can prevent the pathology from developing in the first place, that is the best way for the person to not experience that illness. Okay. So here's an overview of what we're going to be talking about today. First, I'm just going to go over a brief review from previous talks that we've been doing weekly. And then I'm going to discuss hormone balance and a few common conditions that we see in women's health, as well as some treatments, including diet, nutrition, herbs, etc. for these conditions, as well as preventative medicine aspects for those conditions. And women's health really is a very, very large topic. Truly, each and every one of these slides could be its own talk. So there's a lot of information here, and we're just trying to give you an overview. And we can definitely talk more about these things during the question and answer time. So as a review, a hormone is a signaling molecule produced by glands that are transported by the circulatory system to target distant organs to regulate physiology and behavior. So we talked a lot about, I think Dr. Darvish presented on hormones in general. A couple of the hormones that we know are estrogen, progesterone, testosterone, thyroid stimulating hormone, cortisol. So we'll get into a little bit more about each of those. But essentially, it's a signaling molecule. It goes from one part of the body to another part of the body and tells that second part of the body to do something, either to produce more of something or produce less of something or to change in some way. We also talked about stress in previous weeks and how that negatively affects the hormone balance as well as your immune system. And we'll get into a little bit more about that today. And then we will definitely get into more about estrogen dominance, but that is caused by obesity, diabetes, genetics, high fat, high sugar, low fiber diet, toxicity, dysbiosis, chronic stress, and birth control, probably among a few other things, and we'll get into that. And we also talked about a couple of weeks ago about the microbiome and how that affects estrogen metabolism. So here's an overview of sex hormone production, and this can be overwhelming. There's a lot of chemical figures and big words, so that is not the purpose of my putting that here, but I did want to show that sex hormones are made from cholesterol. So when we eat fats, our body turns them into hormones, and that's why fats are so important in the diet. And then you can see that these red boxes indicate enzymes or reactions that happen inside the mitochondria. And the mitochondria are the little energy powerhouses inside the cells. And so that's where we're producing a lot of ATP, which is our cellular form of energy. That's also where we're breaking down fats and turning them into hormones. So if there is mitochondrial dysfunction or issues affecting the mitochondria, you can imagine that this first step might be inhibited, and that's going to be a big problem for the rest of this entire process because we don't have that first ingredient that then gets converted to all these other chemicals. So mitochondrial dysfunction definitely affects hormone health. Some of the things that it can affect the mitochondria are definitely heavy metals and other toxins, as well as inflammation, viruses, and a variety of things. You can see the green boxes are the smooth endoplasmic reticulum. That's another organelle inside the cells where these other reactions occur. And then I just want to zero in on cortisol being over here, the estrogens being over here, and you can see there's three kinds: estrone, estradiol, and estriol. And then testosterone and dihydrotestosterone, its metabolite, are down here. So they're all one big family and are converted from cholesterol. So here's just an overview of the women's hormone cycle pre-menopausally. I use this diagram a lot with patients because I think it's really helpful to understand what's going on at certain parts of the cycle. So a woman's cycle and a healthy cycle is considered to be around a 28-day cycle, and there are two phases, a follicular phase and a luteal phase. The follicular phase is the first half of the cycle. That's generally day 0 to day 14. You can see that down here. And then the luteal phase is day 14 to about day 28. And day 0 or day 1 is considered the first day of bleeding. So you can see the uterine lining is starting to be shed here. And that's the follicular phase. Up here, you can see the growing follicle leading up to ovulation, which happens at about day 14. And then you can see the corpus luteum decomposing after that, after pregnancy is not achieved. So what's happening with the luteinizing hormone and follicular stimulating hormone is that they're relatively low throughout the month, except for a big spike around day 14, and that's what causes ovulation. You can see the estradiol is rising and is the dominant hormone throughout the first half of the cycle until it drops significantly at ovulation, rises a little bit longer throughout the luteal phase, and then drops again. You can see that progesterone is low throughout the first half of the cycle and then is the dominant hormone throughout the second half of the cycle. So all of this combines to create what's happening in the uterine lining, which is a shedding and then a building up of the lining and then a shedding again. And when women are experiencing symptoms either around ovulation or the week before your menstrual cycle, that is due to some of the changes in these hormones and some of the actions of those hormones on these blood vessels that are feeding the uterine lining. And we'll talk more about that. So here is a cycle or a chart of the estradiol and FSH levels. So for estradiol, throughout the menstrual cycle, you can see it rises and then is dropping, and you can see that FSH is rising at about day 14. We kind of already saw that on the previous slide. But what I wanted to show about this slide is that in chronological years, you can see that right at about menopause, FSH starts to rise, and that's when estrogen is dropping. So we don't have that feedback to say, okay, there's enough estrogen, don't produce anymore. And so the brain is like, okay, I need more estrogen, but you're not producing estrogen, it's postmenopausal. You can see during the premenopausal years that at about puberty up until whenever menopause occurs, there's a cyclic production of estradiol. So in previous presentations, I think we talked a little bit about unopposed estrogen and the causes, and those are listed here. One of the biggest causes is synthetic estrogen use. Obviously, if you're using estrogen, that is going to put estrogen in the body. And so that can lead to unopposed estrogen. And by unopposed, I mean that there's more estrogen in comparison to progesterone, because progesterone, a big part of its role is to oppose estrogen and keep it from having too significant of an effect on the body. Estrogen is sort of a growth hormone. It is causing cells to multiply and grow. Progesterone maintains that, and the cycling between them keeps things in balance. But so a big cause is synthetic estrogen use, both birth control and hormone replacement. Anovulation is another cause of unopposed estrogen, because if one is not ovulating, the estrogen is not going to drop as it should and will just maintain at a high level for prolonged periods of time. Liver issues can contribute to unopposed estrogen because the liver plays a major role in getting estrogen out of the body, both in metabolizing it to different metabolites as well as transporting it from the bloodstream to the gastrointestinal system, where it is then removed through bowel movements. So if there's liver congestion, liver inflammation, toxicity, infections such as viruses and so forth that are affecting the liver, that's going to inhibit the body's ability to metabolize and get estrogen out of the body. And then another cause is negative lifestyle factors, so smoking and alcohol. Both of these can contribute to increases in estrogen as well as a decreased ability to get estrogen out of the body. Digestion issues can contribute to unopposed estrogen because the microbiome and the gut itself plays a major role in getting estrogen out of the body and metabolizing estrogen. So if one is not having regular bowel movements, so say a bowel movement every 2-3 days, then the stool, the fecal matter, is sitting in the gastrointestinal system longer than it should be. And the body will then resorb a lot of the toxins, including estrogens, back into the bloodstream, because that's how your body regulates water in the body. Poor diet, of course, affects estrogen for a variety of reasons, but like I said, high fat, high sugar, low fiber are all going to contribute to estrogen issues. And then we can also think about a lot of the toxins that might be present. I think that's down here as well. Excess exposure to environmental xenoestrogens. So we're going to talk a little bit more specifically about that, but definitely a big exposure to xenoestrogens is in our food source, pesticides and so forth. Unrelenting stress can contribute to unopposed estrogen, because estrogen is actually a stress hormone. So it will rise with stress along with cortisol. And so unrelenting stress is going to maintain both cortisol and estrogen at a higher level. Stress is, of course, a normal part of human existence, of human life. If we didn't have stress, we'd be probably very bored and not so stimulated. But the issue with stress is then when it is chronic, prolonged, and unrelenting. it becomes more of an issue because the human body doesn't have time to recuperate or recover. And that is where stress management techniques come in really important, like exercise, meditation, and so forth, so that you're giving your body that time to reset from everyday normal stressors, especially when there is very large stressors going on in the world. Inadequate progesterone is, of course, a large cause of unopposed estrogen, because if you don't have enough progesterone around, it's not going to be opposing estrogen at all. So unopposed estrogen increases the risk for a number of things. Here are 5 of the major ones. Cancer, of course, being kind of the big scary one, but also heart disease. Autoimmune diseases are highly associated with high estrogen levels. And this is not something that is as commonly known mainstream, but that we look at it as naturopaths. And then unopposed estrogen can also contribute to candida overgrowth, which is a type of yeast in the gut that can cause leaky gut, and it has also been shown to escape the gut and get into the bloodstream, can even grow in the brain and other organs. So that's not a fun bug and not a yeast that you want around in your body. Unopposed estrogen also contributes to insulin resistance and diabetes, which of course increases inflammation and a host of other negative consequences. So how do we reduce unopposed estrogen? We can address the 2:16 ratio of estrogen metabolism, and what that means is we can increase favorable 2-hydroxyestrone to unfavorable, so decrease 16-alpha hydroxyestrone. And so a lot of you might be patients of ours and you're familiar with the Dutch test potentially. And that shows us exactly how estrogen is being metabolized. So we can look at whether the 2:16 ratio is appropriate and how we can modify that, because each of these reactions that metabolize estrogen can be supported in different ways. And we'll talk about a few of those later in the presentation, but things like broccoli, mushrooms, and different things can help to shift the metabolism more towards the favorable 2-hydroxyestrone. We can also talk about discontinuing synthetic estrogen use. So that's oral contraceptive pills and hormone replacement therapy. This is a really difficult topic, especially for premenopausal women, obviously, that are using birth control pills, because there are not a lot of healthy, safe alternatives to birth control. And if a prevention of pregnancy is the #1 goal, then often birth control is sort of a necessary tool that we need to use, though there are some birth controls that are less problematic as far as the estrogen toxicity than others. So I definitely work with women on that. However, a lot of times in mainstream medicine, birth control is used as a treatment for really any menstrual complaint. So heavy bleeding, cramping, acne, irregular cycles, either too frequent or too far apart. A woman can go in with any one of those concerns and many others, and always the option is birth control. And I really disagree with that, because we have a lot of safe, natural ways to modulate hormones and reduce those symptoms in a natural way that is not providing synthetic estrogens. We want to be looking at these symptoms as sort of a red flag, as your body saying, hey, something's out of balance. And sometimes that just means, okay, we need to get you more essential fatty acids in the diet, or we need to remove these toxic xenoestrogens and pesticides. And so again, treating the cause is really important. And then hormone replacement therapy, I mean, we have bioidentical options. I don't see why any woman would want to use synthetic hormone replacement, as it is more associated with certain forms of cancer, whereas bioidentical hormones do not have that risk. And then we also need to address anovulation conditions by restoring the cycle. So as I mentioned previously, if a woman is not ovulating, the estrogen is going to remain elevated because the body's not getting that feedback signal to say, okay, estrogen can decrease now. And so we want to look at why anovulation is happening. And sorry, anovulation just means lack of ovulation. So we want to look at why the woman is not ovulating and what we can do to support ovulation. We also want to support phase 2 metabolism. So that means liver support. because phase 2 metabolism happens in the liver. And we can do that with a variety of vitamins and nutrients and herbs that are, in general, just promote that step of metabolism of estrogen. And that's just getting it out of the body, therefore reducing the high estrogen levels. We also want to remove obstacles to cure. So these are negative lifestyle factors, as I mentioned before, smoking and alcohol. Smoking actually gives off a lot of cadmium, which is a heavy metal, and cadmium is itself a xenoestrogen. So it acts as estrogen, or can act similar to estrogen in the body, and stimulate a lot of those pathways, which can then lead to high cancer risk, higher risk of some of the other issues that high estrogen has. We also want to improve digestion, and I mentioned previously the gut plays a big role in getting estrogen out of the body. We want to reduce stress because, as I mentioned, estrogen is a stress hormone. And I don't mean eliminate stress, because I don't think that is possible for humans. But I do mean learning how to respond and sort of reframe it in your life to something positive. We also want to eliminate environmental xenoestrogens, and I do have a slide that is more specific about that in just a bit. And then maintain healthy body weight. Adipose tissue is actually an organ in the body. So those fat cells are producing inflammatory cytokines, estrogens. They are acting as their own sort of organ. And that essentially decreases aromatase, a goal is to decrease aromatase, which converts testosterone to estrogen. And a big reason the aromatase is present often is an excess amount of adipose tissue. I don't know why I can't click. There we go, clicking forward. So how do we improve estrogen metabolism, or the 2:16 ratio? Here are a number of things that you can include in the diet. Cruciferous vegetables are a big help. So broccoli, cabbage, cauliflower, any brassica, so Brussels sprouts, bok choy, etc. All of those are going to be helpful in metabolizing estrogen down a less inflammatory pathway. And then indole 3-carbinol, or diindolylmethionine, is actually derived from broccoli, but you would have to eat quite a bit of broccoli in order to get a therapeutic dose. So we do have these compounds in certain supplements. And so if we find that a woman's or a man's estrogen metabolism is off, we can use these chemicals or these supplements to help to push down more favorable pathways of metabolism. Flaxseed is another way of helping the 2:16 ratio be more optimal. Soy isoflavones, genistein, and diazine. I don't know exactly how to say that word, but diazine sounds good. I do have a slide later on that, just talking about the soy controversy, so we'll get a little bit more into that. Fish oils can be helpful, so omega-3 fatty acids, reducing dietary fat and increasing dietary fiber. And again, the fiber really is helping to grab all kinds of toxins in the gut, including estrogen, and get it out through the stool. Certain herbs can be helpful as well: rosemary, kudzu, and turmeric. So anovulation. Again, this is long periods of higher estrogen levels in the body and inadequate progesterone, so low progesterone. The increase and then drop in progesterone is what is responsible for menstrual bleeding and shedding the lining of the uterus. So if you're not having that change, the increase and then the decrease of progesterone, you're not going to have the menstrual bleeding and shedding of the uterus. So we see this often in anorexia. A woman's body, if it's not getting the nutrition that it needs, it's not going to want to make a baby. So ovulation is often halted, and really anything that is considered more of a growth process is going to be halted. Polycystic ovarian syndrome can also be associated with anovulation. Prolactinemia, which can happen for a number of reasons, but prolactin is a hormone that comes from the brain. Stress and other health conditions can also create anovulation. So here are some of the dietary and gastrointestinal factors that we think about when improving estrogen in the body. So we want to reduce inflammation in order to improve nutrient absorption and microbiome activity. So when the gut is inflamed, it's not going to be absorbing the nutrients as efficiently as it can. So you might be eating a whole host of beautiful, colorful fruits and vegetables, but if you're not absorbing all of the vitamins and nutrients from that diet, those vitamins and minerals can't get to where they're needed. So you can imagine the vitamin B6, the vitamin B12, the different things that are needed for the liver to metabolize things like estrogen will be reduced. And then microbiome activity is important because it plays a big role in estrogen metabolism as well. So the bugs in the gut are actually helping to transform and get estrogen out of the body. So balanced flora is also connected with that. Flora just means it's a nice way of saying bacteria that is in the gut. We talked about improving diet, and I've mentioned that previously. We want to see one bowel movement per day. And again, that is just so that we are ensuring that estrogen and other toxins are moving out of the body appropriately on a regular, everyday basis, and that they're not getting reabsorbed in the large intestine by sitting there for longer than a day. We want to improve binding, and actually, just to go back, an ideal number of bowel movements is actually even 2 to 3 bowel movements per day, but a minimum of 1 is what we're looking for. We also want to improve binding and elimination of estrogen and metabolites, and we do that through a high fiber diet, and in some cases we'll use tools like chlorella, which is a type of algae, and charcoal to help bind up things in the gut and make sure that it's getting out with the stool and not being resorbed. Phytoestrogens can also be something to look at, and phytoestrogens are agonists by displacing stronger endogenous estradiol, as well as antagonists, which block the binding of estradiol. So phytoestrogens are really interesting chemicals to look at in the body, and we're going to be talking about that within the issue of the soy controversy in just a little bit. So when we're talking about eliminating xenoestrogens, again, xenoestrogen is the technical term for some of these synthetic chemical compounds that behave as estrogen in the body. So they come from various sources. Plastics are a really big one. The thing that's not listed here is bisphenol A, BPA, and that's probably one that you all are familiar with because a lot of water bottles and different things like reusable water bottles will say BPA free. The issue is actually that there are thousands of other xenoestrogens. So BPA is not the only one. And so just because something is BPA free doesn't mean that it's free of phthalates and alkyphenols and a host of other potential xenoestrogens. So really just avoiding plastic in general is important, especially not heating your food in it. Food processing and pesticides can be a big source of xenoestrogen. So DDT, the big one I'd like to mention is glyphosate, and that is found in Roundup, which was produced by Monsanto. And that can really cause just a number of issues in the body and toxicity in the body, leaky gut, as well as behave as a xenoestrogen. Cosmetics are a huge source, unfortunately, of xenoestrogens for women. And so it's important to look at the sources of your, both your cosmetics, your, face wash, face lotion, anything that's going on your body. The cells of your skin are essentially, they have a fatty membrane, which means that they're sort of, the cells are coated by fat. And a lot of these toxins are fat soluble, so that anything you put on your body gets sucked up into your system and absorbed really at a really high level. So you want to make sure that the products that you're putting on your body are clean. One of the best ways to ensure that is the Environmental Working Group's website. There's one other website I think that you can go to that I'm sort of blanking on, but I think I'll look it up during the question and answer period. Heavy metals, as I mentioned, cadmium can be a big source of xenoestrogens and a problem in the body. Cadmium, again, is really high in smokers and also secondhand smokers, so people that are around smoke a lot. Electric systems such as flame retardants and PCBs are a big source of xenoestrogens. Sources of combustion, cigarettes, diesels, polycyclic aromatic hydrocarbons. I think that's actually hydrocarbons. This is a French paper. Pharmaceuticals can be a big source as well, and then certain plants and mushrooms derived compounds, so isoflavones, but we'll talk about the phytoestrogens and the fact that they are not as dangerous as xenoestrogens. So how to eliminate xenoestrogens continued. So the first thing is to educate yourself about endocrine disruptors, which is another way of saying chemicals that are going to disrupt your hormones, that are either going to act as hormones or reduce your ability to make hormones and so forth. So the Environmental Working Group, ewg.org, is a great website. And from there, they actually link to a number of different sources. And so it's really important when your doctor can only spend between, maybe 25, 30 minutes with you, but we can't always do as much education as we would like, but there's a lot of information out in the world. And as long as you're getting it from a trusted source, that can be really helpful in just understanding some of the issues that might be affecting your health. We also want to buy organic food whenever possible, especially what we call the Dirty Dozen. And the Dirty Dozen is a list of 12 foods that the Environmental Working Group puts out every year. And these are the dirtiest produce items. So fruits and vegetables that have been tested and have been shown consistently to have the most pesticides compared to other produce. They also put out a list called the Clean 15. And the Clean 15 are 15 fruits and vegetables that are considered the cleanest. So these have the least amount of pesticides across the board. So when there is a budget and we can't buy everything organic, then you can buy non-organic Clean 15 produce, but always buy organic Dirty Dozen produce. We also want to avoid using pesticides in our own home and yard and on your pet. So some anti-flea and different products that you might put on your pet are actually really big xenoestrogens and can not only harm your pet, but also yourself and your children. You also want to find out if pesticides are used in your child's school. I would also add your work or daycare center, and campaign for non-toxic alternatives. There is just really a lack of education out there. So somebody might think that they're doing a good service by getting something really clean and using the most strongest product possible with a lot of toxic chemicals. And you just want to be sort of gentle in that those toxic chemicals can be more of a problem than actually what is being cleaned from the environment. Avoid fatty foods such as cheese and meat whenever possible. If you do eat these foods, just make sure they're coming from a good, healthy source. So if it's meat, that it's grass-fed, hormone-free, and so forth. If it's cheese, kind of move towards sheep and goat versus cow. You also, I would include nuts here. So whenever you're buying nuts, including nut butters like almond butter, you want to make sure that those are organic, because fat is what is going to hold on to toxins. So cheese, meat, almond butter, peanut butter, all of those things are really going to hold on to any toxins that were that the product was exposed to in the production. So if it's an almond and pesticides were used, those pesticides are going to stay right in those fatty molecules or makeup. And so then you're just eating straight pesticides. So again, fatty foods, organic only, clean sources. If you eat fish from lakes, rivers, or bays, check with your state to see if they are contaminated. So the Puget Sound is definitely pretty contaminated. It actually has been shown to have quite a bit of pharmaceuticals. I think there was one report, I don't know if this was a myth, but that there were fish that were growing 3 eyes that were definitely fish that were sort of hermaphrodite. They couldn't tell whether the fish was a female or a male. And that could more or less be contributed to the amount of birth control that's ending up in our water systems, and therefore a lot of estrogen. So these male fish are starting to look hermaphrodite. Not sure what sex they are. Obviously, there's horrible environmental repercussions for that, but you don't want to then give your own body those chemicals and hormones. So avoid heating food in plastic containers or storing fatty foods in plastic containers or plastic wrap. Definitely no saran wrap around your salmon. I hate that that's how you buy it from the store, but the best thing to do is go to the butcher, buy it. If they sell it in saran wrap, take it home and take that off, because again, fats hold toxins. So when you put plastic next to fat, it's going to absorb a lot of those toxins. Do not give your children soft plastic teething toys, because those plastics leach potential endocrine disrupting chemicals into the baby. And then you want to support efforts for strong government regulation of and increased research on endocrine disrupting chemicals. So of course we we always need more information, and supporting regulations towards that end is important. Estrogen and progesterone balance involves a number of factors. So progesterone is produced by the ovary only after ovulation. And I showed that in a previous slide, but you saw that progesterone was low throughout the first half of the cycle and then high second half of the cycle. Progesterone in general will maintain the pregnancy. And so that's really important, especially in pregnant women, in order to maintain the pregnancy. Progesterone also has receptors throughout the body, though, so it has sedating and mild pain relieving effects, as well as anti-inflammatory properties. So you can imagine that a woman with low progesterone might be anxious, might have chronic pain issues or chronic inflammation issues. Estrogen and progesterone tend to balance each other, so it's really the amount of each hormone that is important. It's not necessarily the level of estrogen or the level of progesterone, but the relationship or the ratio between the two. Again, lowered progesterone production can be due to anovulatory cycles, prolactinemia, and luteal phase defects. And luteal phase defects means an issue with the second half of the cycle. Sometimes it's too short, sometimes the hormones that are being produced during the second half are not being produced, and so forth. So progesterone opposes estrogen. And so when we're thinking about a goal of opposing estrogen, we want to support progesterone levels by including proper diet choices and balanced blood sugar, so lower sugar, lower refined carbohydrate diet. We often will use progesterogenic herbs, including Vitex agnus castus, which is chaste tree berry. And that herb stimulates pituitary to secrete luteinizing hormones. So it's often an herb that we use with anovulation because that's going to help send the message to the ovaries to ovulate. A number of other nutrients include B6, vitamin E, boron, zinc. All of those are going to support progesterone levels. Selenium actually increases progesterone receptors, or has been shown to in animal studies, as well as soy foods in breast cells. Beta carotene we think about, or we know as food for the ovaries, and this is vitamin A. It's found in highest concentrations in the corpus luteum. So if you don't have enough vitamin A, the corpus luteum is not getting the nutrients it needs. We also can supplement progesterone directly. So in some cases, USP progesterone in a pill or cream, and here at Holistic can be used. Here at Holistic we use bioidentical hormone cream. And then designer progestins and birth control pills may not provide a full range of signals as bioidentical progesterone does. So that's another point on the favor of bioidentical hormones. So the soy controversy. You may have heard about the fact that soy is controversial as to its effects in the body with respect to estrogen levels. Two isoflavone compounds in soy, genistein and diadzine, are considered phytoestrogens, which means they are plant compounds that act like estrogen in the body. So there's been a lot of media saying, is this good, is this bad, and so forth, but there was a wide metastatic, or a wide study that basically concluded that higher intake of dietary soy is associated with lower risk of breast cancer. And then they also, a different study showed that there was no increase in mortality with intake of soy once diagnosed with breast cancer. So essentially, studies have seemed to contradict each other and depend on how they were carried out. And that means, were they animal studies, were they human studies, were they prospective or retrospective, and so forth. But the bottom line is that soy had either a beneficial or a neutral effect on various health conditions, including estrogen-related cancers. The real issue with soy is that it is highly genetically modified, and that means it's going to have a lot of pesticides when it's not organic. So the safest way to do soy, again, can be beneficial, is to buy organic, non-GMO, and non-agrochemical, so non-pesticide soy. Okay, so just a few of the common women's health conditions that we see. So PMS, premenstrual syndrome, and over 90% of women experience some form of premenstrual syndrome. So that's really quite a big proportion of women. that are affected by PMS. And it can involve depression, anxiety, fluid retention, including breast fullness, weight gain, bloating, and edema, as well as crampings and cravings. And so with PMS, we think about a number of different things. And there's a lot of words on this slide. You don't need to necessarily focus in on any one of these things, but I just wanted to show that when we're talking about a condition like PMS, it's not just like, oh, give them magnesium or, oh, give them this herb, because it's not necessarily a one-to-one relationship. We really look at the specifics of a condition and what is driving those symptoms. So for example, if a woman is experiencing depression or experiencing PMS with a large emphasis on depression more than anything else, especially premenstrually, that's caused by a decrease in estrogen as well as serotonin, and we might use St. John's wort, which is this pretty little yellow flower that's actually really common in the wild and you might see on the side of highways quite a bit. We also might use adrenal tonics, especially if there's a fatigue with the depression, as well as nervines and phytoestrogens. Nervines are basically herbs that modulate the nervous system. So if anxiety is more the common or more the dominant type of PMS that a woman is experiencing, that is usually associated with low serotonin and high norepinephrine, as well as high ACTH, which is the hormone that is going to be acting on the adrenals to produce more cortisol. So when we see that, we want to improve estrogen recycling in the liver and also encourage more frequent small meals that increase tryptophan, which is then converted to serotonin. If it is with exhaustion, we might use Withania somnifera, which is ashwagandha, and we might decrease alcohol, sugar, and caffeine in the diet. And I think I'm probably running a little short on time, so I'm gonna breeze through a bit of this, but you can always send me an email and ask me a question. But when there's fluid retention, that is usually due to increased aldosterone. We might use magnesium, taraxacum, which is dandelion, as well as Vitex. When there's cramping and heavy bleeding, that's usually due to a prostaglandin imbalance, which means an inflammatory molecule imbalance. Often with high animal fat diets that will occur. We might use magnesium, essential fatty acids like evening primrose oil, again, increased progesterone. We might use tanacetum feverfew, which is another pretty flower. If there's cravings, that's often a sign that there's a blood sugar dysregulation issue. So we might use chromium, zinc, decreased stress, and so forth. So with endometriosis, this is really an estrogen dominant condition. The symptoms are progressive, severe dysmenorrhea, often a painful abdomen and abnormal uterine bleeding, which can mean heavy bleeding during the menses, or it can mean intermenstrual cycle bleeding, so bleeding throughout the month or sporadically. It can also cause and be associated with infertility, as well as painful bowel movements, bladder symptoms, and low back pain. Some of the risk factors include multiple births, extended periods of lactation, menarche, so start of menstrual cycle, menses after age 14, more common in tall, thin women with low BMIs, and Caucasians. Some of the lifestyle things that we will do is avoiding caffeine. Caffeine in the body is actually metabolized through the same pathway as estrogen. So if you're drinking a ton of coffee, your body is not going to be using that pathway to metabolize estrogen. You can think about it as a funnel, and everything is going into that funnel. We might use an anti-inflammatory diet to help with this, support liver function, avoid xenoestrogens, kind of a lot of the things that we've been talking about so far with reducing estrogen dominance. So with polycystic ovarian syndrome, this is quite a complex condition. I showed basically a diagram of some of the pathological aspects here, and that might be sort of overwhelming scientifically, but I just wanted to show this because we do look at exactly what is happening. You can see that genetics, obesity, sedentary lifestyle, as well as intrauterine androgen exposure can be some of the triggers. Polycystic ovarian syndrome affects 1 in 10 women of childbearing age. Obesity is found in about 60% of these women. And any women that goes to be seen for acne, about 37% of those patients actually had PCOS. And so that's a really important thing because not many people know what PCOS is and they don't know to talk to their doctor about it. But often if you're having acne, it's actually a root underlying issue of PCOS. So The definition of PCOS is just that you need 2 out of these 3 things, basically: ovulatory and menstrual dysfunction, hyperandrogenism, which can mean hirsutism, acne, and androgenic alopecia, or hair loss, as well as polycystic ovaries. So because you only need 2 out of 3 of these, you don't actually need to have polycystic ovaries to have polycystic ovarian syndrome, which is commonly misunderstood. Some of the long-term risks of PCOS are fertility issues, cardiovascular disease, insulin resistance, diabetes, cancer, and mortality. So it's definitely something that you want to address. Some of the ND treatments include weight loss, anti-androgen treatments like spearmint and palmetto. This is saw palmetto up here on the top. It's a really pretty leaf. We might use insulin sensitizers. We may try to improve ovulation, such as with Vitex agnus castus or chasteberry berry, which is this purple flower. We may use vitamin A, again, food for the ovaries, or use lifestyle modifications to reduce stress. Infertility is a really big topic in women's health. 12% of women have difficulty getting pregnant or carrying a pregnancy to term. The definition of infertility is no conception after 1 year of trying to conceive, but they reduce this time to 6 months after the age of 35, and the intention is that women get the help they need, because it does become harder to become pregnant as we age. And so they want women to get the help they need sooner if it's an older woman trying to get pregnant. So there's a number of different causes: improper timing of intercourse, ovarian dysfunction, some of these conditions that we've talked about, mechanical disruptions, so sort of structural issues, endometriosis, which can cause both hormonal imbalance and structural issues, and then unexplained is given about 10 to 20% of infertility. So you can see some of these messages from the brain to the ovaries, and the messages back from the ovaries to the brain, and any step in this process can cause a problem in achieving pregnancy. So some of the ND treatments for infertility, again, we often look at the foundations of health: diet, lifestyle, exercise. We want to remove obstacles to cure: alcohol, smoking, etc. We look to optimize health. So again, if a woman is wanting to create a baby, you want to give the woman the nutrition, the environment, the kind of components needed to signal to the body that it is a healthy time to bring a baby into the world. If you are starving or not getting the vitamins you need, or exposed to a lot of toxicity or under a lot of stress, the body's not going to be like, hey, now's a really good time to make a baby. So we just are working to optimize health. The men's health is really important too. So getting the sperm evaluated, making sure things are not overly inflamed, that blood sugar regulation is healthy, and so forth. Some of the herbs we use are, again, Vitex agnus castus, which is just a great women's health herb. Asparagus racemosa is this herb in the bottom right corner. This is a fertility tonic, also enhances libido. It's also adaptogenic, and that means it works with the adrenals to adapt to stress. And it's also immune modulating. So I wanted to use this herb because it points out the fact that a lot of these plants have multiple actions, whereas a drug often has a one-to-one relationship in the body. Many herbs and plants will have a multitude of positive effects that can all work together to support the goal that we're trying to achieve. Often there's a lot of inflammation that is really preventing pregnancy. So the fact that this herb is both a libido enhancer and can modulate the immune system makes it a really beautiful way of intervening and supporting pregnancy. So cancer, obviously this is a major topic and a really, really worth its own seminar or 30-minute talk, whatever this is, weekly talk. But 38% of women will develop cancer in their lifetime. This is a really staggering statistic. That means basically 4 out of 10 women will develop some form of cancer. 1 in 8 US women will develop invasive breast cancer in their lifetime. Again, a really staggering statistic. If I think about 8 of my girlfriends, 1 of those is going to develop cancer in their lifetime. Cervical cancer is another important topic because it's highly preventable with routine screening. So pap smears, we do pap smears at Holistic. So please stay regular with those because it is such a preventable form of cancer. Ovarian cancer is really important. It's often missed because it can just look like bloating in a woman, especially older women. Oopsies, how do I go back? There we go. So some of the breast cancer risk factors: excess estrogen, we've been talking about that this whole time, and poor estrogen metabolism, increasing age, obesity, a high fat diet, high alcohol intake, nulliparity or not ever being pregnant, and a late first pregnancy, also not breastfeeding. Of course, the family history, either in mothers or sisters, can contribute to risk as well, as about 5 to 10% of breast cancers are thought to be inherited, so BRCA1 or BRCA2. So as far as naturopathic preventative approaches to cancer, we often will use this form of imaging that is seen here. This is a thermography image, meaning that it is a heat image. So we can see that the axillary area, the lymphatic area is hot. We can also see a lack of blood flow to certain areas. So thermography is often used in conjunction with a mammogram to look at the breast tissue in slightly a different way. So it may pick up on some of the inflammation and some of the clues that might suggest there is a problem with hormone balance and with blood flow and inflammation, possibly heavy metals, and something that we need to treat so that it doesn't develop into breast cancer. And also when there is early cancer, it can often identify that. But as far as prevention goes, we of course want to talk about whole foods diet, regular exercise, maintaining ideal weight, managing stress, and not smoking, and then regular screening. With adjunctive oncology, again, we'll likely spend a whole talk on cancer, but we will often incorporate diet, mind, body, spirit support, nutrients such as high-dose vitamin C, and then nutritional supplementation of many different types, but CoQ10, melatonin, vitamin E, and vitamin D included. So osteoporosis is another major women's health condition. You can see that this is normal dense bone matrix, and this is osteoporosis. So you can see that it's much less dense, and that contributes or leads to a high risk of fracture. So approximately 25% of women will develop osteoporosis in their lifetime, and half of women over the age of 50 will break a bone because of osteoporosis. Risk factors include hormone dysfunction, heavy metal toxicity, and poor diet. We will use a DEXA and other hormone tests to evaluate, and we prescribe a lot of lifestyle treatments for this, including weight-bearing exercise, because that weight-bearing exercise is going to increase the density of the bone. Of course, maintaining a nutritious diet, getting levels of vitamin D up and calcium, and then we'll often use IV therapy. And the reason that I use this photo here of this sort of electrical body is to say that our bodies are truly electric in nature, and we often will use pulsed electromagnetic frequency therapy in the treatment of osteoporosis because that can help send messages to the body to increase bone density. I think I'm probably running out of time, so I'm really trying to kind of wrap it up. Heart disease is a really important topic within women's health because 1 in 4 female deaths are caused by heart disease. So it's definitely the leading or a leading cause of death in women. 1 in 3 women have cardiovascular disease, and 64% of women with sudden deaths due to coronary heart disease had no previous symptoms. So it's kind of this sort of hidden cause of death that we definitely want to look at in women. Often people think more about men when it comes to heart disease, but that is a falsity. So risk factors, traditionally diabetes, smoking, obesity, being overweight, physical inactivity, hypertension, dyslipidemia, those are common things that we think about, but some of these new factors that we're finding contribute to heart disease are important to look at, and those are birth control, preterm delivery, issues within pregnancy, so hypertension and gestational diabetes, autoimmune disease, breast cancer treatment, so chemotherapy, etc., radiation, so forth, and then depression actually also contributes. So some of the naturopathic treatments: regular exercise, avoiding cigarette smoking, both first and second, as well as third. So third is when you're exposed to smoke from, say, a fabric or so, like not necessarily you're standing next to someone smoking, but you're in a room that has carpet or furniture that was exposed to smoke, and that actually increases the risk for heart disease, among other things. Weight reduction and maintenance, omega-3 fatty acids, improving cholesterol, improving insulin sensitivity and blood sugar regulation, eating a heart-healthy diet. You can see this beautiful salad down here. Improving autoimmune conditions, reducing inflammation, detoxifying environmental toxins, as well as ozone therapy, which we do here intravenously often, and that has been shown to reduce some of the biomarkers associated with severe cardiovascular disease. So that about wraps it up. And I know that that was a ton of information. Trying to squeeze that in within an hour is difficult, but if there's any questions, I will go ahead and unmute you. How do I unmute?
Thank you so much, Dr. Marian. That was awesome. I just want to remind everybody that this presentation is for informational purposes only, and please do seek either one of our physicians or one of your own physicians for answers to your conditions. I want to let you know that also tomorrow we will be on Instagram Live, and Facebook Live, except that because of all the events going on in the world today, we're going to focus in a little bit more tomorrow, not on women's health, but on the impacts of social justice on our health. So that's going to be between me and Dr. Marian having a discussion on Holistique's Instagram. Actually, it'll be Holistique's Facebook page, and then my Instagram, which is dr.darvish.nd. So it's a big topic, but the science behind the shifts that happen through social justice are really fascinating to understand for all of us. And then secondly, please note that next week we will have another webinar, this time on sleep, and it will be with Dr. Nina Paru and Dr. Julianne Morella. So if you have any sleep issues, next Wednesday is the webinar day, and look for the emails coming out on Monday or Tuesday of next week with the Zoom link. Really appreciate all of you joining us today. Please know that this webinar and several of the past webinars have been recorded, and they're on my specific website, drdarvish.com. You're also able to access some of them through YouTube under my name, and share them with whoever you please. So look forward to seeing you next week, and thank you so much again for joining us. Thank you for a great presentation, Dr. Marian.
Thank you.
Thank you so much.
Thank you.
Thank you. See you next week.
Bye.
Bye-bye.
Bye.
Bye. Thank you.
Bye.